Mr. Derek had acute low back pain. He bent down and twisted to pick something up and his back went. How many times have you heard this story from your patients? Hundreds of times as an osteopath. For him, that started 39 years prior. He bent and twisted, his back went, he went to see the chiropractor. The chiropractor whacked him up and down, and he felt better for a short while, for a few weeks. And then went back to see his chiropractor again and again and again for 39 years. It made him better for 2 weeks, sometimes for 6 months, and he had to return every time. In 2019, summer 2019, same thing happened, same pattern, his low back went to see his chiropractor. It made him worse this time, not better. So he looked at alternatives, he found me, he came to see me, we examined his body, and we found a liver lesion. Liver causal lesion with a compensatory pattern throughout his body. Great, we treated that. It was on a physiological level, so that's within the organ, so we had to use more fluid drive and motility-based osteopathic techniques, so that realm of osteopathy. His liver completely resolved, the pattern resolved, and he walked out feeling great. He was almost 100%, but he got 100% over the next few days without touching his L5. So what happened in this scenario? So, for Mr. Derek, more than 39 years ago, that liver lesion would have started. I don't know when exactly, all we know is that it's more than 39 years ago. It's on a physiological level. It was the detoxification part of his liver, so at some point there was too much detoxification demand for his liver to cope, and that protective lesion occurred, and the neurology started creating that lesion and the lesion pattern. And that was the predisposition to set the scene for his low back, for things to get irritated when he bent down and twisted. And the big link with the lumbar spine and the liver is the iliopsoas muscle. So the tension in the liver builds up through the iliopsoas muscle, which attaches to the body of L1, L2, L3, L4. It does attach to the body of L5, but not to the disc of L5. So the L5-S1 junction is free from the iliopsoas tension. So what we do get is a group lesion of the L1, 2, 3, 4, which are stuck in flexion, right side bending and right rotation, typically with the liver 9 times out of 10. And that means the L5 is able to compensate and does compensate for that group lesion, and it gets stuck in extension, left side bending and left rotation. So that creates the scene for nice torsion there, which is why when we released his liver with a physiological approach, not mechanics, there was no point stretching his liver about, unlike the other example, Miss Sheila, she had a mechanical liver lesion. It needed to be treated mechanical with BLT approach and then mobilization. Whereas with Mr. Derek, it was physiological. So we treated that resolved. The iliopsoas tension resolved, the group lesion of L1, 2, 3, 4 resolved, and the L5 was then free to function normally rather than being stuck in ERS left. So our reflections is obviously the cause of the symptoms isn't necessarily where the symptoms are. It usually isn't, it usually is somewhere else. More importantly though, bending down and twisting is not a cause. It does not cause anything. It's a natural movement. And if there are no predisposing factors, no preload within someone's body, they can bend down and twist without having pain, without that becoming a trigger for symptoms, like what happened to Derek for almost 40 years. So there's a demand. If we have the demand and the predisposing factor, the demand becomes a trigger and we get symptoms. But if we take away the predisposing factor, which in this case was a liver lesion with a whole liver pattern influencing his lumbar spine, we take away that predisposition, and then since then he can bend down, twist, pick stuff up. He even laid some carpet in his house without having a bit of low back sort of achiness, which we'd all get, but without having that acute episode at all. So that's the difference, big difference between demand and causes. We can work on causes as osteopaths, remove those, and then patients are free to demand on their body normally. So this is fun as a practitioner. We get another low back pain patient. It'll be a different story. So every story is different, and we get to the bottom of things, and we resolve things, and we have true, long-lasting results, which is exactly what patients want. They want to come in a minimal amount of time. They want the session to make sense, and it does. It's cause and effect. Every human being understands the principle of cause and effect, and this is how to apply cause and effect to the human body. And more importantly, they walk out with results. And then they call you the next day, not to tell you that they worse, but to see if you can see their wife, or their parent, or their sibling, or whoever. This happens a lot. And then your clinic becomes high in new patients and a bit lower in continuing patients. And that's what most people who apply a causality framework within their osteopathic practice tends to find. So if this information resonates with you, head over to the contact page. You can always fill in the contact form to ask us a few questions, or just fill in the admission form. Looking forward to maybe teaching you one day. Bye!